Hey, Mark, great to see you. I hope you're well as we're entering the holiday season. An exciting opportunity today to talk about a piece of content around AI, a topic I think has a lot of value for listeners. This idea of where does AI fit for workforce planning, operational efficiencies, and healthcare. Healthcare has always been an early adopter of cool technologies like advanced analytics, advanced data management, but AI is super exciting. What are your thoughts on the impact of AI in this space right now?
Couple of things. First off, like all technologies, it's to be leveraged. So where can we pick up this technology, if you will, and put it in the hands of various users in various use cases? It's not the most simple technology to pick up, though a lot of us have experienced maybe the most simplistic forms of it, but really to leverage it to enable people, automate things, make people more effective and accurate in what the work that they do. So I'm looking forward to speaking with you about how that is and where that can be used.
Healthcare generally has been an early adopter, as I said, of kind of cool and interesting technologies. Machine learning found its way into things like optimizing staffing levels, saving money through smart staffing, and so on. But I think that AI opens up the door a lot wider to bring in new data sources to influence not just do you have the appropriate coverage at your facility, but that you're balancing it with quality of life for your employees, bringing in different data sources to understand how your team is executing, how they feel about what they're doing. I find that the amount of data that we can bring into these processes is really interesting now.
That's for sure. And for our audience, I think it's important we differentiate machine learning versus AI in the sense that if we program something like machine learning, we can program what we understand. But really, could we leverage AI to assimilate something that we actually didn't program for it to pick up patterns that are naturally in the data that we didn't see before? I would say, sometimes, the doctor says, well, I have a feeling. Okay, well, that's actually more AI-like than I'm predicting this to go this way or that way. So I think for the audience, on thinking about, wow, if I could bring together data sets and let the machine suggest what the patterns are and how it derived those patterns, I mean, what sources influenced how it came up with that, I think it's super key to leveraging AI, today.
Our research indicates that most people that dove into AI early, they were leveraging relational databases, organized and curated data. But the door is swinging pretty wide right now on streaming data, real-time sort of data, and unstructured data is finding a really interesting place in the value proposition. You go back to what we're talking about, like optimizing staffing levels, bringing in employee survey data, bringing in employee review data, bringing in unstructured data from the facilities. It's making that idea of all of your data needs to be AI ready a reality right now.
That's right. It's still bringing data into AI isn't like, oh, just grab this drive and start AIing it, right? There is some pre-processing that's relevant to tagging data, giving it time, because maybe that was something that was true 2 years ago, but is not true today, let's say in an HR policy or something like that. So bringing data in, but also giving it some context so AI has the information and the responsibility of answering the most accurate and complete way that it can.
I think companies that are providing AI as a service or part of their solutions have also come to understand that they need to have proficiency around getting to that data, because you're absolutely correct. It's not, I like how you said it, AIing that data. It's not that simple. A lot of the data that you feed into AI models, like large language models, for instance, really add additional context and insights into the actual business. So in a health facility or healthcare company, infuses AI with really highly pertinent information about their business, the outputs are a lot better and a lot more contextually accurate.
They are. And so then you apply, okay, what would those use cases be? I thought it was really great in the healthcare surveys that not only did when a patient or provider responded to a survey result, it's interesting, of course, to get their 5-star or their 1-star rating statistically, but it's also very important to get the words. And it's interesting how we, all growing up and learning to write words, would say something. We've even corrected surveys because the words they said were really positive, but they selected 1 star because they thought that was positive, or a 1, excuse me. Usually stars actually are better, well-known thing. But nevertheless, the answer that people would give from a 1 to a 10 or whatever may not be clear, the words in the question, but then they wrote something glowing about it. And so we were able to highlight where the intention was actually the opposite of the value. And it was statistically significant enough where we then said, let's use the AI corrected answer.
Back in the early days, and you and I we've been around a little while, we used to see a lot of articles and content that was written about how we were making critical decisions based on 20% of the enterprise data that was available, right? And again, that was back in all those relational databases. This idea of marrying unstructured data, streaming data, even edge data from IoT devices and so on, influences and impacts the insights that we get when we're applying it to healthcare, workforce management, and other topics around us. Do you see an uprise with your customers jumping beyond rows and columns of data and looking at other data sources and bringing in more of their holistic data to get better insights with AI?
I do. I feel like those and many that decided to adopt some data literacy. What does that mean? That means I could understand the dimension, the structured data attributes, whether it's time or department or service area, something like that. Those that I could argue with the data. So the measure that I was getting back or the information that I was getting back is now in the context of that. So I think over these recent years, data literacy has improved. The reason why that's important is then we can ask a better question and we can give it context. Like, what is this in a generic way? You'll get a pretty high level answer. But if you answer it in the context of age and race and sex and pre-existing conditions and medications, then, oh, wow, that's a very more intimate answer. We fortunately were able to be very much a part of the solutions in and around COVID. Then these capabilities were available, and we were enabling these providers, these experts in this, but this was a new disease, to come out with findings. It's a classic example. We really did not know. And so we used machine learning and we used AI in order to come up with techniques and medication treatment care plans in order to thus improve. And some of our hospitals made it in the top 25 in the nation of outcomes during that horrific time.
It sure, during that period, with all of the data that we got to consume about that particular disease, it swung the door pretty wide for us to apply analytics to it in a way that was meaningful. And I absolutely agree with you. The opportunity to provide insights based on what was occurring in the moment was very interesting and a great application for forecasting, predictive analytics, and of course, AI in general. It's interesting. AI seems like it's been part of our lives forever. The big disruptor for Gen AI was just, 700 and some days ago, 2 years ago, that Open AI made their announcement about ChatGPT. But we're starting to see those interfaces more in the world, and we're starting to see it again in healthcare and healthcare management, and especially around operational type things. Do you see it playing a big role in how it interfaces with, we talked about how it can impact staffing, but What about retention and employee wellness and employee satisfaction? Uh, Maintaining your relationship with the staff and the teams that healthcare facilities have put online is really important because rehiring, retraining, and filling gaps is a lot more expensive. Do you see a lot of use cases for that in the world?
I do. I do. I think we are open, humans are open to, if you will, a conversation now with technology. And we've seen that. And what that means then is it now starts to understand a little bit about me. And am I working the night shift, or am I specialized in this particular disease state, or what department that I'm in? And these things it would start to understand, which is great. And thus, when now it's starting to have a conversation with me, I'd love nothing more than my device to say, "Hey, Mark, I see you're switching from the day shift to the night shift coming up. Here are some best practices I notice that others have transitioned well in. And here are the things you should look out for yourself in that didn't go well for some of your colleagues in your role, in your department." So it's really interesting such that it would deduce that. Now, the one thing I like about certainly one of our technologies, Click and AWS, which are our primary two strategic vendors, is that it allows you to put boundaries on it. I don't know if your audience knows, but ChatGPT will answer your question. If you ask it a question, it will answer it to the point where it will absolutely make it up and have no qualms about it. Why? It was designed to grab all of the knowledge and best formulate an answer to a question. It will not say, "I don't know." So I would ask your audience to certainly, when it's evaluating technology, to say, will it tell me that it doesn't know? Will it tell me the sources in which it derived the answer to the question so that I could either formulate a better question, or tell it, you know what, that's close but not right, or actually that's a great answer and it made value to me. So that whole feedback loop that's directly to the audience that's engaged in the AI, but also to the background, to the information systems people that are curating that data so they can do better as well. So it's not a closed loop, ask and it'll say whatever it'll say. And that's so unfortunate. Some people call it hallucinations, but it's even more so than that. It will answer your question and make up an answer because that's what it was designed to do.
It's not healthcare specific, but I'm an analyst, so I have a huge ego. And I once asked it, ChatGPT, if it knew who I was. And I was really impressed that it said, well, there's a lot of people named Shawn Rogers. Which one are you asking? And I gave it a little more feedback, and it gave me a great answer. And it even mentioned that I had written a couple of books. And when I looked a little closer, I realized, well, I didn't write that book. You can't take it on face value. I agree. I think some of the best apps are the ones that can say, hey, we're not sure this answer is accurate, or we can't provide an answer at this time because we don't have enough feedback. I often, when I interact with these systems, will tell in the prompt, ask me as many questions as you need to get the context and the parameters of what I'm after. I think we'll all become prompt experts in the future at varying degrees and levels, but I also think that the challenge will be is the service providers who are building really cool apps around this will help make that easier. And it's a good segue to challenges because we both see them. I will say that access to data and orchestration of the proper data is a challenge. I will say that still skill sets maintain top of mind. And I know that when I talk to healthcare professionals a lot, they ask me about where do we find the best people for X and Y. But the hidden one is cost. And the sophisticated users, the people that are out ahead a little bit, that have been doing AI a little longer than the average company, are bumping into some pretty traumatic cost awakenings. What's your feeling? You and I've talked about cost in advanced analytics and AI. What are your feelings there?
So, first off, I always like to start with the value proposition. So let's take any initiative that someone's going on, that if I doubled productivity in the area that I'm going to provide AI, what would that mean? So that would give me context because I may have 300 nurses, or I may have two heart specialists and it's all they do is surgery or specialties on the heart. So let's put it in the context of what would the value be if I doubled productivity in one or more of their activities. Great. Now I have the value side. Then I can turn to the cost side and say, what would it cost to implement this? And there's two types of costs, and please make sure your audience would do some multiple, and maybe you, Shawn, could advise them on this, is what is the human IT multiple, the human cost, as compared to the service cost, whether that be AWS or Click or some of these other technologies that offer AI out there, because the ability to curate high quality, curate meaning tag and enable and put the professional boundaries around the data, takes people's time. AI is not automating all of IT. In fact, it's increasing the need for specialists in the AI area. And so we've invested in that so that we have athletes that are able to do that effectively and quickly here at IPC Global. But my point being is, yeah, it is costly, but there's interesting things because we're finding repeat patterns in there. I can dramatically reduce the human cost in pulling it off. And technologies like AWS and Click very much are reducing the cost of bringing that because they automated. Let's say there's 12 or 15 some odd technologies to implement this. Well, these companies I mentioned, brought it down to 3. I can use 3 technologies and off I go. That means what do they call, the technical debt associated with getting into AI is very real, unless maybe you've got a vendor that is really providing a more complete package there.
Yeah, one of the things that Bark identified in his research is that people that are more advanced with AI were willing to wait for key partners and key product vendors to be ready to do what they wanted to do in order to de-risk this type of innovation. They wanted to rely on the partners they had and the solutions they had in-house. So as an analyst, I get to keep track of where companies are at with delivering new things. And AI was a lot of slideware for the first few months, and it evolved into real hard deliverables that are being used. But we saw that a large group of advanced users said, in order to innovate, we'll wait to make sure our partners are ready to help pull us across the finish line. And I think that trust in partners and trust in the underlying applications and solutions is really key when you want to be innovative and disruptive with new tech.
It really is. And I don't believe there's unicorns out there. So when you use the word partner, what we're able to bring to the table as a systems integrator for AI is the expertise on those components, the expertise on preparing the data, the expertise on publishing that mechanisms of AI out into the user community. But let's be clear, we are not experts in heart surgery or nursing or emergency room or even other industries that we work in. And so what's really good is that's where that partnership comes into play. My team personally has published, I think we're up to 9 research papers now in the last couple of years since COVID. But we didn't actually, some of the words that they use in the research, I still don't really know what they mean because they're very medical but the data, I know exactly what it means. And the result of the benefits, I know exactly what that means. But it's really a partnership with the subject matter experts and the AI team.
I'm glad that you said subject matter experts, because that expertise coupled with a disruptive technology like AI is where the value lives. And companies like yours have the ability to combine both right out of the blocks. And I agree, you don't have to understand every single medical term, but the idea is that you can apply operational efficiency, proficiency to their problems to either get them the right ROI. Well, you and I have talked about staffing a little bit today. We talked about employee wellness and bringing in outside survey data and things of that nature. You even made a neat comment about, we noticed that you've moved to the night shift and here's 3 tips to be more successful. And I was thinking those types of tips come from unstructured survey and feedback from employees. And like HR groups will run those surveys, but they don't always make it into these types of applications. And that's where the expertise for understanding the data landscape can be really valuable when you're
For sure. And let's be clear, AI is engaging people. So it's not necessarily engaging machines, though I could give a few examples for that. But it's really, how do we engage people? And that would really, for in our example, HR, give them a new leg up, a new differentiator that they could engage the workforce with some capabilities that would make it a better experience, make it a more fun experience. I'll be honest with you, AI is interesting in the sense that I didn't actually ask an HR person the question. I asked the AI thing a question, and there's some, I don't know, distancing from, oh, I wonder what they're going to think of me. Well, the AI isn't thinking emotionally, at least, for that person. So I think that's a very important aspect of what AI is also bringing us.
That's part of this workforce management idea that we led the conversation off with. And you're touching on internal services like calling HR and asking a policy question or needing to understand something about your healthcare benefits. All of this lends itself to employee wellness and employees being happy. Again, you have to introduce your enterprise data to those models so that they can coherently answer the question. So if I go to the HR information center and ask the AI tool a question about my healthcare benefits, for instance, it has to have a deep understanding of the policies and the rules and which healthcare am I on, because we're a large company and we offer 4 different plans and all of that. So this contextual data, we touched on it earlier, but it becomes even more important when you're serving stuff that is exactly tied to your business.
Yeah. And I'd love nothing more, as it does sometimes when I'm driving my car, it prompts for a recommendation. I'd like nothing more that, hey, Mark, I saw you just had a life event. Here's some things that we see in changing, in your example for healthcare. Here are some things that people have taken advantage of. Oh, I didn't even know that was available. And so those are some neat things. Is could AI actually be looking out for us in a way? And the answer is how we get there. But you mentioned bringing data in. The interesting thing about it is there's a lot of data available today that we can just bring in. We can then bring it in and evaluate it as a tier or an initial set of uncurated data. But then, okay, that's interesting. Let's apply some curating techniques for the ingestion to make it better. And literally over a couple 30, 60, 90 days, you could very rapidly get to a valuable, trusted piece of information. And that can be augmented further, or you're starting in a new area that, again, if we can improve productivity of people and recognize the value of that, is it worth the cost?
I'm not going to drag us down the technology road too deep, but for the technologists that are listening to this conversation, we're touching on this topic of RAG, R-A-G, that so many of you read about and hear about. This is this idea of retrieving and then augmenting your models with internal data, enterprise data, your healthcare company data, right? So it can be everything from existing work schedules to patient care information. All of these things add context and affect the accuracy of your AI-driven system, so that you can do what Mark said up front, which is not just figure out what you already know, but figure out what you don't know through inference and others. So it's highly important being able to integrate all types of data into your AI environment.
And any of your decision makers out there, I would imagine Shawn with his books and moreover his company Bark, if you could go and grab a couple of the resources that are available there, because it's not one, it's actually several ways that we can look and leverage the technology. And so which of those ones or a combination would be best for a use case, or consult with a systems integrator who would, maybe boil that down to the use case that you're thinking about that would add value. So
We did a great piece of research that your main partner, Click, helped make possible through their sponsorship this year, which was about optimizing your architecture for AI. It's
nice.
available on the Bark site, and anybody that's interested should take a peek at it, because we talked to a global audience of people that were implementing AI, And one of the things we found out is that leaders in AI are utilizing domain language models. So we talk about large language models all the time, the big popular ones that the big hyperscalers are making possible, but small models or domain language models are very popular. And healthcare was at the top of that list. So models that are specific to the healthcare industry. Mark, you must stumble on these multi-model environments with your clients.
Yeah, we do, and they're bringing ones to the table that they're familiar with, and we're making recommendations primarily because there's so many options on there. We decided early on at IPC Global to be the best in the world at something, right? And so we picked AWS and Click, and so we very much look to leverage that. Otherwise, you're a jack of all trades, master of none. So those that are interested in leveraging those technologies to their fullest and having folks with 15 to 20 plus years experience in using them and keeping up with the evolution of them, I think that's important. Yeah, it'd be firms like ours.
I'm glad you mentioned your speciality. Yeah, give us a little wrap on IPC Global and how you attack the market. I know that you specialize in healthcare as one of those verticals, but give the audience a little insight on how you do things.
Yeah, so 25 plus years ago, we're doing enterprise implementations, and many of you all have done that. Those are hard. But interestingly enough, when we got to the data part of it, the data processing, the reporting, analytics, and AI, that was kind of like fun, happy dollars. And so I'm like, well, I'm going to grow older in my career at some point. So why don't I jump on that? So 20 plus years ago, we very much focused our firm on being the best in the world at data analytics and then leveraging AWS and Click technologies. And those companies have beautifully evolved from what they were to what they are today. They're certainly worth a good look at and an evaluation when you're considering doing that. And so we are those companies. AWS, we're at their what they call the advanced tier. There's only one tier higher, and there's not many of those in the world. So we've got a couple more years to make it to their top tier. And then certainly for Click, we've been at their top tier for a very long time. In fact, we're the only partner in the world to win Global Partner of the Year 2 times. We've trained more people in the world than any other partner on that technology. And yeah, we're very good at it. And they're very focused on data engineering, data analytics, and AI, such that anybody that is looking to do that, every company has to do it at some point. Should look at those. One thing interesting I'd also like to highlight for your audience is, we do data differently. I mean, everybody else, well, let's put it in a structured database and then transformate the data, create the golden record, then put a view over it. And what Click, interestingly enough, on top of AWS, has automated those steps. So I can go from data to system-generated view to information delivered. And the reason why that's important and that we do it differently is the only way that we're going to get to a near real conversation with a person is going from source to screen or conversation in a stream-like way. I think you and I would all be super frustrated if we were driving to wherever we were going and the system would say, I'll update you on traffic tomorrow, or I'll update you with traffic an hour from now. That's horrible. We need streaming and micro batch level technology in order to provide information, including AI, to me. I'd like it to make a recommendation. Mark, I see it's coming up on noontime, and I know this that you typically like to hit a Chick-fil-A. So I recommend this one 3 exits from now if you'd like. Yeah, that'd be great. Thank you. Oh, would you like your typical order? Sure. So now it's even placed my order for me. So why is that possible? It's because I've integrated multiple technologies and it's near real time. And I think the value of AWS and Click to a major degree and differentiating degree is simply like that. We call it more advanced use cases, but I think the advanced use cases is becoming more commonplace. I would not buy a car today if it didn't have the capabilities it does, right? And so I feel like going back to dashboard tools, God forbid. I mean, what's interesting about my relatively new car is the dashboard is gone and they've integrated it into the navigation system. And that's what I think AWS and Click provide us.
Well, it aligns and I 100% agree. It also aligns with our expectations, whether we're an employee at a large healthcare company or facility, or if we're a consumer on a website or driving our car. We expect AI now to be part of our lives. We
Mhm.
expect to get that recommendation, that automation, that deeper insight. And you made a very critical kind of point. There is a window of value for insight. If the insight comes too late, it's not valuable. I expect to get those insights and those automations in my workflows while I'm doing my job or driving my car or while I'm shopping on an e-commerce site. I get annoyed with the site that doesn't tell me what shirt to buy with the slacks I just purchased. I expect it to tell me what works. And I think that expectation is flowing over into our work world.
But it's not there yet necessarily in the sense that imagine this, you're walking into the emergency room um, for something, and now you're represented with information about the number of people in the queue and what is the wait time for the check-in person, the admit person versus actually be able to see a doctor. What if the fact that now that you're being diagnosed, you notice that the doctor has actually been being prompted with other ideas about people like you that have gone through the health system on certain medications, certain ages, and things of that nature. What if they said, Mark, we're going to admit you, and right then it says, your room will be ready in 23 minutes? What? Yes, it's being cleaned right now. Oh, that's great, right? And this other person by name is going to come pick you up in a wheelchair, if that's okay, and take you up there. Oh, wow. So this whole prompting and engaging along the care journey all the way through on and on through discharge and follow-up. I'd love nothing more than my phone to vibrate or ring and says, Mark, I noticed that you didn't pick up the meds within the 30, an hour of your discharge. Can we help you with that? Can we get Uber RX to deliver that to your home? Oh, wow, that'd be great. I forgot, or something happened. So my point being is engaging. We're using healthcare here today, but engaging in the workflow and the objectives of the system are super at our disposal. And we just need to leverage those from vendors who provide that.
Mark, great to see you. Fantastic conversation. I think the use cases and applications of AI in healthcare, whether it's people management, patient management, facilities, uh, it's limitless with AI. And it's fun listening to you riff off of 15 different use cases while you're just sort of talking because you guys are so used to delivering them. Thanks for joining me. And it was a great conversation.
Shawn, same to you. Thanks so much.